Hi, I'm Dr. Thomas Su at Artlipo, a clinic devoted to performing only liposuction and devoted to creating the best possible results. As a liposuction specialist doing only liposuction for the past 8 years, I've performed over 10,000 cases. And what I've found is that it takes a lot of experience and skill to produce consistently good results. As a specialist, I perform about 20 cases of liposuction a week, and that's compared to about 2 cases that most general plastic surgeons perform in their average week. Many people are surprised that a plastic surgeon does so little liposuction. However, their schedules are filled with tummy tucks, breast augmentations, and facelift procedures. Liposuction is one of the most difficult surgeries to do and to do beautifully, and it's very difficult to become an expert at it unless you specialize in doing lots of it. Being a specialist in the medical field is a good thing because that means it's all you do. However, being a specialist is not the same thing as being an expert. There are still specialists and specialty clinics doing just liposuction that are not very good at it and never will be very good. What I've seen is that there's a number of liposuction clinics which are all about doing a lot of volume and not necessarily interested in putting quality first. Liposuction is a very labor-intensive surgery. Many doctors aren't willing to devote the time and effort to do things completely. Imagine that you go for liposuction and only half the fat's removed. You'd likely be disappointed because you wouldn't have the results that you were hoping for. Unfortunately, this seems to be the standard for many of the liposuction clinics out there. So when a surgeon removes only half the fat, he's only making things smaller, and rarely produces the beautiful curves and shape that are possible. I know how this works because I take care of patients that have been to these clinics on a regular basis. I'm talking about patients that had liposuction done by another doctor and see only small improvements. And then when I see them and I pinch them, I find that there's still quite a bit of fat there. And on some of these patients, it's hard to tell that liposuction was even performed. What's even worse is that when the surgeon is not very skilled, the results can even be lumpy and uneven. So when you're looking for liposuction surgery, you really want to have an expert. When I tell people I'm a liposuction expert, it's because I consistently produce results that are very complete, very smooth, and reveal a very noticeable improvement in their shape. And that leaves my patients thrilled. Becoming a liposuction expert didn't happen just because of the many surgeries I've done. It happened because I've always had a passion and dedication to performing the best possible work. It happened because I'm willing to spend double or sometimes triple the amount of time that most surgeons spend on doing the same surgery. And it's a result of a continual pursuit of improvement in my technique. So what makes me a liposuction expert and different from the vast majority of surgeons is not just the quality, but it's also the complexity of the cases that I take on. Most doctors would avoid very large patients and discount them as poor candidates for liposuction. This can be because it's very difficult to handle a very thick layer of fat and the loose skin that sometimes comes along with it. Well, I've become very expert at doing large patients and creating outstanding results that are life-transforming for these patients. I also do specialty types of procedures that most liposuction surgeons have never attempted. These include doing high-definition arm sculpting, that's sculpting around the entire arm, which reveals, the sculpted muscle contours. This is something that probably less than 1% of surgeons can do. I also do full thigh liposuction, which can slim the entire thigh, not just the upper bulges. To do full thighs smoothly requires extreme skill. And I also treat one of the most difficult areas of the body, and this is the cankles. Most doctors are afraid to touch this area. One of the things I've mentioned is I do redos and corrections. This is one of the things that takes the most skill of anything because the tissue underneath when someone's already done liposuction can be scarred and it can be very difficult to achieve even results after someone's already had it done. So if you can perform correction liposuction on patients, you've actually mastered and become an expert in your field. So thank you for watching this video. If you'd like further information, you can find more informative videos on our website. These videos elaborate on all the different body areas, and you'll find lots of great before and after photos. I'm Dr. Thomas Su at Artlipo. Thank you and good luck.